my name is Madison Gray. I am a student nurse here at the University of South Alabama, and I'm going to be performing the medication administration checkoff. So first I'm going to scan the room. Okay, so the first thing I'm going to do is plan for a no interruption work zone. So I'm going to make sure my door is closed, I'm not answering any phone calls, and I'm limiting my conversations with my colleagues. So the first thing I'm going to do is compare the medication on the MAR and the patient care order form for the 5 right. So I'm going to make sure I have the right patient, the right medication, the right dose, the right route, and the right time. So I have Jaguar Jones, heparin, 5,000 units, subcutaneously, every 12 hours. Every 12 hours, I'm also going to compare the allergies. So I see he has allergy to penicillin. So now I'm going to begin perform hand hygiene, and then I'm going to get my vial and I'm going to compare it to the MAR to make sure I have the right vial. So I have heparin, 10,000 units per milliliter, and the expiration date is 12/5/2025. So I'm going to show that to you. So I'm going to make sure I have the right time now. So it is given every 12 hours, and it has not been given in the past 12 hours. And the right route is subcutaneously, so I'm going to be using a 1 milliliter TB syringe, 25 gauge needle. And I'm going to correctly identify my calculations before I begin. And I see this vial is to be given 10,000 units per milliliter, and the patient needs to receive 5,000 units, so he will be receiving 0.5 milliliters. I'm going to clean the vial, and then I will pull up about 0.5 milliliters of air, and then I will inject that into the vial. And then I will pull up a little more than 0.5 milliliters of heparin so that I can flick out any excess bubbles and then inject it back to 0.5 milliliters. And then I'm going to recap using the scoop method. Now I'm going to verify that I have the right calculations with my MAR. So I have heparin, 5,000 units, or 0.5 milliliters. And then normally I would let another nurse check my calculations. And then now I'm going to do my second check for accuracy. I have Jaguar Jones, I have heparin, 5,000 units, or 0.5 milliliters, subcutaneously, and then every 12 hours. So now I'm going to make my label. So on my label, I'm going to write the patient's name, Jaguar Jones, the medication, heparin, and then the dose, 5,000 units or 0.5 milliliters, and I'm also going to initial it. And then I'll place this on my syringe. And I'm going to take this with me to the patient's room. So when I get into the patient's room, I'm going to perform hand hygiene, and then I'm going to identify my patient using 2 identifiers, and I'm going to be using his armband and the MAR. So I see I have Jaguar Jones, date of birth 8/25/1963, date of birth 8/25/1963. I see he has an allergy to penicillin, and I would ask my patient if he had any other allergies or what his allergic reaction might be, and I'd perform any necessary pre-administration assessments for the specific medication. And now I'm going to do my third check for accuracy. So I see I have Jaguar Jones, I have heparin, 5,000 units or 0.5 milliliters, subcutaneously, every 12 hours. So now I would explain the procedure to the patient and letting him know when I'm going to be giving him the injection. I will raise the bed to a comfortable working height and lower the side rails. And then I will put on my goggles and my gloves. And then I'm going to explain where I'm going to be injecting the site. So I'm going to be doing this in the abdominal subcutaneous site that is on the stomach, and I want to make sure to stay away from the 2-inch border around the umbilicus, and I do not want to go above the intercostal margin or below the pubic area, and I do not want to go past the anterior superior iliac spine. So, and I want to also assess the area for the skin integrity and any bruising that there might be, and my patient does not have either. So I'm going to clean the site in a circular motion with the alcohol pad. And I'm going to leave that pointing the site where I just cleaned and let it dry. And then I'm going to get my syringe and uncap it and dispose of it into the sharps container. And then since I'm able to pull up 2 inches of the skin, I'm going to go in at a 90-degree angle and inject the medication. Take out, dispose, release, apply gentle pressure, being careful not to massage. Okay, and now I'm gonna reposition my patient back to a comfortable position, lower the bed to the lowest level, raise the side rails, and then I'm going to take off my gloves and perform hand hygiene. And then I would assess the site to see if there was any allergic reactions, and then I would document how the patient tolerated the procedure or if there was any allergic reactions, and that would be my 6th right. And then I will come back later to reassess my patient to see how he tolerated it and if there were any allergic reactions. Thank you.